Dr. Stephen Rath of Fusion Medical in Reynosa, New Mexico, and we're going to film a short video about carboxytherapy. So Susie has been gracious enough to allow us to film her carboxytherapy procedure, and we'll go ahead and get started, and then I'll talk a little bit about carboxytherapy and its history as we go along. So I'm going to use a little bit of a sterile prep. I'm going to start treating her right near her eyes, because this is one of the areas where you get the most improvement. So what's happening right now is a little bit of CO2 is going in her skin. Carboxytherapy dates back to the at least to the 1930s. In France, they did it at the Royal Spa to help make skin look younger. As skin gets older, it gets thinner and the blood supply decreases, and that's one of the reasons why this procedure is beneficial, because it actually helps increase the thickness of the skin. I've had a couple of procedures around my eyes now, and the blood vessels around my eyes are actually less apparent than they were before. So as you can see, this area above and below Susie's eyes is puffed up fairly significantly. If she tried to open her eyes right now, there's a decent chance they'd actually be swollen shut. Now the neat thing about carboxytherapy is the swelling goes down very quickly, and that's part of the benefit. So what happens, why are we infusing CO2 into the skin? Hemoglobin is a molecule in our bloodstream that carries either oxygen or carbon dioxide. It has a greater affinity or love for carbon dioxide in the peripheral tissue, and so when we infuse carbon dioxide under the skin in an area with circulation, hemoglobin will preferentially drop off oxygen into the tissue and pick up carbon dioxide. So Susie, this should feel like there's a little bit of pressure under the skin. It shouldn't be horribly uncomfortable. What's your take on how this feels?
It's just pressure.
Okay. So we're using the same size needle that we use to do Botox. So generally, this is not a procedure that requires any type of sedation. We typically don't even use numbing cream before the procedure. We just use a sterile prep to cleanse the skin. We have the patient take makeup off, of course, and then use a sterile prep to cleanse the skin. If we're doing the procedure on the face, generally it'll take around 20 minutes or so. After the first procedure, sometimes there's a little bit of residual swelling around the eye area. We haven't seen it last for more than about 24 to 36 hours. And after each subsequent procedure, that swelling gets less and less, until the skin just looks really, really good. We had a couple patients in last week that we had, they were here for their third procedure, and both of them, you could tell a whole lot of difference, a whole lot of improvement in their skin already. So if you look at Susie's eye area, the swelling has already started to go down. We're treating her cheek over here. We'll treat a little bit around the mouth and then go to the other side. But as you can see, it's a very benign procedure. She's handling it extremely well. We haven't had any patients yet that have not been happy with the results of the procedure, that have not been really uncomfortable during the procedure itself. Okay, Amber, go ahead and pause that. Okay, so in the interim, we spun Susie around. We actually treated her the left side of her face. I'm coming back and I'm finishing off with treating right around the mouth area. In someone Susie's age, the big areas that we're worried about treating are the periocular area and the perioral area, so essentially around the eyes and around the mouth. These are the areas that typically show age the most. Those are actually the areas that I would like to have treated, and as soon as we finish this, I'm going to see if I can't get a treatment myself around the eyes and around the mouth. It does not take very long to do the treatment, and there's actually an immediate benefit where the skin looks fresher, and then with each subsequent treatment the results get better and better. It's designed to be done in a series of treatments about 7 to 14 days apart. Classically, you'll do between 6 and 8 treatments, and so most of our patients we actually have set up where we'll do packages of treatments for them. We will be, we're filming this in October, and we have Christmas coming up, so our Christmas specials will include carboxytherapy this year and subsequent years. So this has been just a short clip on carboxytherapy using carbon dioxide infused under the surface of the skin to help plump it up. Essentially, we're allowing the body to help self-dose oxygen, and with each treatment there's going to be more and more improvement. Each treatment actually becomes more comfortable because it requires less needle sticks. So the carbon dioxide is able to infuse or diffuse better across the skin. So Susie has been a wonderful patient. This is Dr. Rat, the Fusion Medical Spa in Ruidoso, and hope you enjoyed watching this video. Thank you.